The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Dr. Tom Roselle here. You're listening to Ageless Health Livestream, and we've got a great program for you. Hope you've been enjoying all the previous productions, and we're going to try to continue to keep it as interesting as we possibly can. If you've been listening to the radio program on WMAL 105.9, you have been paying attention to pain evaluation. And coming up in a couple of weeks, we're going to be doing a program on migraine headaches. But we want to get into the diagnostic portions of it. How do you know that it's a migraine? Most migraines are vascular in their format. They're not just something that happens to be taken off the top of your head, but that's what it does. And there's a lot of characteristics of that. Generally, there's one-sidedness. Sometimes you vomit with them. Sometimes you get twinkle, twinkle, little star, all kinds of little prodromals, and we could list lots of them. But what I want to cover today is a tool that we use ongoingly to diagnose chronic pain syndromes, but also anything that has to do with vascular impairment that may be causing a pain, something of some sort. And what am I talking about? I'm talking about thermographic imaging. And a few weeks ago, we had a very brilliant physician on, Dr. Peter Leando, and we were able to talk to him in Greece. And he was very, very poignant in how this is about. But I want to bring on a very astute, experienced master when it comes to imaging, and let her tell us what it's all about and how it can diagnose pain patterns. And something that we depend a tremendous amount on when it comes to diagnostics. I'd like to introduce Derreth Painter, who is a certified thermographer. She's been in the game for a lot of years. Derreth, welcome to the program.
Thank you for having me.
This is a very interesting program because we rely on a lot of different characteristics to identify what a migraine or what a chronic pain pattern is, and RSDs and so forth. And thermographic imaging is something that really sometimes points to the direction where in many cases, we're not sure where it's coming from, but this kind of opens up the door, if you will. I'd like to start with simply talking about why thermography is important, but more importantly, what it really is identifying and how that correlates to the pain patterns that we're trying to identify so we can treat properly. And the outcome for the patient obviously is much better because of that. So kind of walk us into the puddle a little bit, and let's see if we can understand it for our audience.
Sure. So first and foremost, let me give you just a brief synopsis of what thermography is. Thermography basically is the use of an infrared camera to assess the body's inflammation or constriction in the body. One of your doctors at Roselle Center for Healing often refers to it as body Doppler. If you think about your weather meteorologists and how they show a storm coming in and exactly where the storm is going to hit and where it's dissipating, essentially that's the same visualization that you're going to get with digital infrared imaging. The difference is we're a little bit better about pinpointing areas of concern than, let's say, your local meteorologist.
So you don't make a prediction and miss the next day, right?
Yeah, we don't tell you that you're going to have 6 feet of snow and you have actually 6 inches of rain. So yeah, we're a little bit better than that. But essentially, what we're doing is we're able to get a visual of the pain patterns that patients are talking about. You get patients who go to doctors and say, "Doc, I have a pain in my shoulder, or I have this this pain in my neck and I don't know where it's coming from. And the doctor will do their evaluations. And in some cases, we've all had the experience where the doctors say, well, I can't find anything. Maybe it's in your head. With digital infrared imaging, we can actually take images of the area of concern and look to see if there is vascular indicators or neurological or muscular skeletal dysfunction that could be causing that presentation for the patient. And as you mentioned before, it can also, in some cases, identify where the pain may be sourcing from. You and I have used thermographic imaging for years now. I think we're going on year 17.
It's been that long.
And I know, we're old.
Shh, be quiet.
We've been able, I know. We've been able to use this technology to kind of fine tune the areas of concern and maybe look at other potential reasons for why that inflammation or that constriction are evident within the patient.
It's a very interesting process because there's a lot of times where a patient will come in and any kind of pain presentation, it's chronic, it's been there for a long period of time.
Mm-hmm.
You get back pain as a referral, but that back pain may not be the area on fire. And in our world, we talk about organ muscle compatibility, if you will. So the nervous system communicates between both platforms. So you have nerves that come off the spinal cord, they divide, they go to organs, they go to muscles. Now, so this patient comes in with back pain and they're showing muscle contraction and they're saying it just hurts all the time. It's an achy pattern. But I send them to you for thermographic imaging, and then all of a sudden that inflammatory level is not necessarily their back. There's some there, but their lower abdominal area is lit up like a Christmas tree.
Exactly. So then by giving you that information, you can either confirm your suspicion or you can look in other areas. Same type of thing. I just had a patient here yesterday who wanted an overall assessment, and we actually took imaging of her hands. And the two last fingers on her hands were absolutely constricted. I mean, completely black, in the imaging for us is referred as cold. And I know by working with you for so long that typically that's suggestive of a upper cervical irritation. And so I'll make that recommendation to the doctor and say, hey, you may want to look at upper cervical, interference. And they'll treat and they'll come back. And then all of a sudden we see through treatment efficacy that pain or that constriction has been resolved.
It's very interesting that something as significant, in my opinion, as thermographic imaging is not used more critically relative to professions generally, because one, it's non-invasive. It doesn't leave a residual. Right. There's no contraindications, really. There's things that you have to look out for because it's not, if somebody has a implant or so forth that's close to the surface, it may distort the representation. But it becomes very specific relative to inflammation, inflammatory reactions, going back to headaches or pain patterns. Even you get a patient that comes in and they have jaw pain, right? So there's a nerve that starts here and it has three branches. One goes to the forehead, another one comes in here, one comes in through here. And they're going to the doctor and they're complaining about this deep pain over their eyes, or they have this throbbing tooth pain, or whatever it is, and they're being treated with antibiotics and treated with steroids, with pain medication. And we send them, we say, listen, it's coming from your temporomandibular joint. And we send them over to you for confirmation, and you take a thermographic imaging of the side of their face, and lo and behold, it's right here. And it's lit up like a Christmas tree, and then you can trace the root of that trigeminal distribution.
Exactly. I get a lot of TMJ patients who will come in and, they'll tell me they have they get headaches all the time, or they have jaw pain. a lot of symptom patterns, and I'll take the imaging, and you'll see right at the TMJ joint, one side or the other, both, where it'll light up, as you put it. And I'll ask them, do you grind or do you clench your teeth? Oh, I don't know if I do. Or they say, yeah, I wear a night guard. And so then what I'll have them do is I'll have them put their fingers on their TMJ joint, and I'll have them open wide and have them close, and they'll notice that either clicking, or they'll notice one side of the jaw drops down before the other, and they'll start to notice that imbalance. And so if they see that visual imaging of that inflammation in that side, they actually get it. So it's not a guesswork at that point what could be contributing to the headaches, or to that clenching in that jaw, or the neck pain. Those are all telltale signs of a TMJ dysfunction.
What I find
same thing with sinuses too, by the way.
What I find fascinating with some of the imaging that can be done with thermographic platform is that if you have pain here, for example, or to the side of the head, you do a thermograph, it'll light up, but it just tells you that there's a hot area here. But if you combine the diagnostics of where that nerve comes from, you turn them around and you take the back of the head, or you take the jaw, now you can see the distribution, and it gives you a direct relationship of where that frontal problem is coming from. It's here's where they're feeling it. It's a knife in their head, but either the jaw or the back of the head, the upper cervical vertebrae, are really what's involved. And you have this greater occipital nerve that comes over the top of the head, and you have one on the side, the lesser occipital, but it comes from the back of the skull and the upper cervical area. Critically important diagnostically, because now you're not wasting any time. You can fix where it's coming from instead of fixing where the complaint is, and subsequently get rid of it.
Do you want to discuss in your world how, if you have one-sided and you have that pain pattern over the eye and it runs back to the base of the skull and down the body, because we do full body imaging, what that indicates to your doctors, your acupuncturists and your chiropractors when they see that in the imaging?
Derreth, when somebody complains of abdominal pain, sharp shooting pain, the other day I said that there was a prodromal on the radio program. We're talking about migraine headaches, and one of the prodromals, believe it or not, is abdominal pain that just doesn't seem to go away. And it's a vascular impairment of some sort that shows up. And it can tell you that there's a abdominal migraine, and there's actually terminology for that, which is kind of cool. But it's signaling out that there's inflammation. Right. Somebody comes in, they're referred to you for diagnostics, and they say, this patient is having abdominal problems. It doesn't seem to be a gastrointestinal situation. It could be, but you determine with imaging where that pain pattern might be coming from.
Yeah, I mean, obviously anything that we do from a thermographic standpoint is going to be suggestive, not diagnosed of. I mean, we'll look at organ systems as to whether or not, for example, liver congestion, could that be contributing to, the fact that people cannot detoxify? So yeah, you may see that correlation between digestion and small intestine, large intestine inflammation, and the pain a person is experiencing. So obviously, with an experienced doctor like yourself and your team, they know to look at that suggestive of the imaging that we show. And again, it could be inflamed or red. Most people, when they look at my imaging, say, what's all that red? What's all that white? But it could be hot inflammation, or it can be a constrictive aspect where the flow of the metabolics is just not working properly. So that is just as important as a red inflammative patterning.
And I want to go back to the first statement that I made about this is a non-invasive procedure. It's one that doesn't have any side effects like x-rays do and mammograms and things of that nature. But it identifies and often pinpoints the area. And, so many years ago, I think we stopped doing them just before COVID. We did a whole day presentation called Ageless Health, which is the name of our podcast, obviously. and you and Dr. Stephanie Pina did a presentation. A patient had knee pain, and you
Yes.
took a thermograph on that knee, and it was hot, it was red, it was really on fire. But then Dr. Pina did acupuncture on the knee, and I think you took infrared imaging every 5 minutes for about 30 minutes.
Right. So the intervals were from the time the patient presented, we took an image. And then Dr. Pina would put in needles in the area to bring down the inflammatory presentation. And so we would take imaging in intervals of 5 minutes. And so every 5 minutes, you would see that inflammation go down, almost to the point where it was non-existent. So that in and of itself demonstrated to the patient that, when people do acupuncture, oftentimes they say, well, what should I expect? What should I feel? And we can actually visually show the inflammation dissipating over time just in one treatment. So that really kind of solidifies for the patient whether or not that particular treatment pattern is effective for them.
Interestingly enough, I was looking at a couple of journals the other day, and then I followed through with some local people, and many people have heard the advertisements for guys with erectile dysfunction. They're going to this clinic and they're using it's a deactor. What it does is it opens up damage to the scrotal area, scar tissue that's occurred over a period of time. But what it got my interest. I knew this has been around for a long time. They've been doing it for quite some time. But this one office was taking thermographic images of before and after to see if it actually was working and opening up the circulatory patterns. And it was interesting. It was I went back, and there's a couple of journals. One is Frontier, the other one's the Townsend Newsletter, and then they actually had some stuff on PubMed. So, it got my say, oh, really? No kidding. It could be used for this. Obviously, we don't do that kind of work in the office, but
unfortunately, that I don't do. Yeah. But ever since COVID, I know a lot of your listeners are not aware of this, that the camera that we use, the Metatherm camera, was actually used during COVID for fever screening in all ports of entry. So we would take large groups of people, and we were able to identify those with a certain temperature aspect, a threshold. That way we could do further assessment on the individual. But thermography now has taken on a significance that it never had before, in that you're right. There's no side effects. It's non-invasive. It's pain-free. A lot of my patients love that. No cumulative radiation, so it's not like you can take multiple imaging and not have to worry about its long-term effects. So it's one of those things. I'm going to go back to the knee aspect that you were talking about. We've also done that, if you remember, Dr. Roselle, Bell's palsy. We had 2 patients with Bell's palsy. One of them was our staff member, and then one of them was a long-term patient. Right. And to be able to show that patient how they can restore their functionality in their facial muscles as a result of Bell's palsy, and the treatment that they were receiving was just critical for them to realize that their function was coming back. It may take some time, but it was visually, it was impactful for them, emotionally, psychologically, as well as physically, to see that.
Derreth, let's go to one of the things that you see on a regular basis. I want to go to breast tissue. We gave guys the creed, so now we'll go to women.
Okay.
So if a woman comes in and you're going to, can you distinguish, and I'm talking about pain, so because that's what we're talking about today.
Sure.
And her breasts are very sore, and they're difficult to touch. The nipple areas, even if she rubs on something, it's painful, right. And that can take place. With thermographic imaging, can you make an assessment that this might not be pathological, that it's coming from someplace else?
Yes, I mean, obviously, we're going to err on the side of being really conservative, and we're going to want to follow up with further clinical correlation to confirm what we're seeing. And that may be in the forms of ultrasound, mammogram, or MRIs. But oftentimes, I do get a lot of women who will come in and say they have pain in the upper outer quadrant, or they'll have nipple pain, or they feel a lot of lumps and they're painful. And first of all, I tell them to breathe. It's, don't, what is your saying? Don't look at,
Always look for horses, not zebras.
yeah. So they're obviously coming in riding zebras, and I'm telling them why don't you go and grab one of the horses in the stall over here? So typically what I'll find is that they've got lymphatic congestion. They're just not moving their lymph system, their axillary area properly. And you obviously can tell everybody why. We're always, on the computer with our shoulders rolled down. We're on our phones dipped down with tech neck. And so that impacts quite a bit on people's ability to move the toxins out of their body. And that often will sit in the breast tissue. You've also got hormonal dysfunction, where women will have a lot of fibrocystic breasts, and too much estrogen, too much progesterone. It's just that imbalance that will cause that pain. So there's a lot that it could be, rather than just going straight to, oh my God, it's pathological. So yeah, the imaging will give us an indicator as to whether or not you're going into an angiogenic patterning, or a feeder pattern, if you will.
Got it.
Mm-hmm.
Derreth, walk us through what thermography really is and the application. Everybody's listening to us right now. We're doing this thermography thing, and it's supposed to pick up a heat signal, but what's the real story behind it? And then what's the process of when you take one?
Okay, so basically what we're doing is we're recording the body's infrared heat that it gives off. And so we're looking at it from the surface of the skin. So when a patient comes in to see me, the worst part about taking thermographic imaging is you got to get naked. So typically what I'll do is I'll have people, if we're doing a breast series, have them, take everything off from the waist up. If it's a full body, I'll have them take everything off with the exception of panties or boxer shorts. And I'll let their body cool down to its normal homeostasis. Once I've established that, then I take imaging from all sides of the body, from, all aspects, front, side, back. I go in specifically to areas of concern. And so I take all of those images, and then with the patient's intake, their medical intake, I will then forward all of that information to a radiologist, an MD, who's been trained specifically to read thermographic imaging. And then they do your typical radiological report. And then that report will be suggestive of what they think may be going on with the individual and recommend further course of action. And then obviously that report goes to the patient and to the doctor for their assessment.
Now, to be clear for our viewers, what we're dealing with is the measurement of an increased vascular supply or an inflammatory reaction due to something. But with thermographic imaging and the right diagnostics backing it up, we can often get to the why is that, and be able to be much more direct and applicable, if you will, based on that type of testing. Am I?
Sure. What we're looking at is blood flow, and we're looking for metabolic changes over time is specifically what we're looking at. We cannot see anatomical anything. So we can't see bones, we can't see organ systems, but we can see the function around those, whether or not they're sluggish, whether they're constricted, whether or not they're, we look at carotid arteries oftentimes. And if it's blocked, it's like, an explosion ready to happen. So we're going to see that inflammatory aspect of that lack of or impaired blood flow or lymphatic flow or whatever it is that we're looking at. But yeah, we're we're looking at different information. So, as I tell people who come in for mammograms or look for digestive evaluations, we're just the other piece of the puzzle. We're kind of that missing piece of the puzzle that you often don't see when your doctor sends you out for different types of imaging.
In my experience, is an incredibly critical part of the puzzle as well. Obviously, it can be, if you will, hand in glove, and it should be hand in glove with other diagnostics. You'd never rely on one piece, just to open it up completely. We know that pain patterns show up as hot inflammatory reactions. A bursa, which is a cushion, if you will, between muscles and bone and ligaments and bone and so forth. If there's an injury to that area, that bursa swells, you have an inflammatory pathway that's evident, and that will show it up there. And you can distinguish it between a vascular problem and an inflammatory pattern when you combine what you're doing with the proper orthopedic neurological diagnostic, and not just somebody who touches the area and says, oh, it's hot, and oh, you must have torn something. Those are the things that kind of light my fire up, and I get irritated when a patient walks in with that type of thing. Now, what I also want to know is that that when we do a thermographic diagnostic, can it determine if there's a sense that there's underlying damage? I know that it can't show the tissue that's developing underneath it. It doesn't show a tumor, for example, in the breast.
Right.
Can it suggest that it's there? And if so, how does it?
It can suggest that, but more importantly, it can show the disbursement or the range of that inflammatory or that impact on the body. So you can see whether or not it's isolated or if it's been diffused throughout the body. One other thing I'll tell you, it's not just the heat, and I often tell people this too. You've got several of patients of yours and mine that are Raynaud's patients who have pain in their hands and feet. Yep. But how does it show on the thermograph? It shows an absolute black. And I tell folks, don't ignore that either, because that in and of itself tells you that the body is not functioning properly.
How does a Raynaud's, here's an interesting question. How does a Raynaud's show up opposed to somebody who's just getting cold hands and feet all the time when the weather's bad? Are the thermograms different, one from the other?
Yes. Insofar as we're looking for patterning, so we're looking not only in color but also in grayscale. We're looking for symmetry within the body to see whether or not it's affecting both sides. But also, one of the things that we look at is we look at an immune marker on T2, T3 on the back of the neck. And if a person has an immune compromise, typically you're going to see what we indicate as like a bullseye effect on that T2, T3 area. That, coupled with the presentation of cold hands, cold feet, suggests that it is an immune dysfunction, and it is more so than just a circulatory problem. Does that make sense?
Makes total sense.
Yeah.
So how about a woman?
And you can tell them how that means about wind point, because that's kind of an interesting point as far as Chinese medicine.
Yeah, when you're talking about thoracic area, it's the thoracic spine, it's the upper portion of the spinal area, it's the second thoracic vertebrae, is which he's indicating. And that has to do with, in Chinese medicine, calls a wind point, actually just a little above that. And Asian women, invariably, if they're walking outside and there's wind, or it's cold outside, they're going to put a scarf around their neck to protect those areas, because it stimulates and breaks down the immunological receptors within that area. It's kind of an interesting study, but that's thousands and thousands of years old.
Right. That's where the bad qi or disease goes into the body. And even during the summer, Asian women used to put silk scarves on to cover that wind point. We discovered in thermography that when a person has an immune dysfunction or the immune system is struggling, you will immediately see that bullseye on that area of the body, which is fascinating to me.
Derreth, you said, initially that thermography is starting to be more widely accepted, and you're,
Absolutely.
you're seeing people kind of just show up. And why is that? Why suddenly, and it's been around for decades.
Yes.
Years ago, when it first was introduced to this country, it was used to determine structural faults in construction sites,
Yeah.
beams and so forth. And then there was more medical applications, more so out of the country than here. And then,
Before that, military application.
yes,
So yeah, absolutely. I think in this day and age, patients are really taking more charge of their health and well-being, and they're looking for information that is going to support their ability to shift the paradigm. They want something that is safe. They want something that is effective. And they're not willing to just go by standard of care, which a lot of them get very frustrated with when their doctors are told they're not allowed to do this process or that process because you have to jump through these hoops. I get that with patients every day. That they want something that is visually going to help them to maneuver through their health journey in a way that it gives them usable information.
it's an important piece, as far as I'm concerned, to distinguish a lot of things that people think are the zebras, and
Yes.
all of a sudden you say, hey, slow it down. This is not pathological. Watch the trail. This is where it seems to be coming from. This needs to be treated in this way. And invariably, if you use the diagnostic acumen with multiple approaches, but this being the foundation of several things, all of a sudden you can say, hey, breathe, it's easy. And you get to take care of straight up. Derreth, you're the principal in Thermography Centers of Virginia, and hopefully if anybody has any questions, they can reach out to you. How would they do that?
Well, the easiest way, obviously, is to reach out to your office. I prefer them talk to a live person than leave a voicemail. Your receptionists are phenomenal in answering very basic questions, but also to track me down so that I can get on the phone and in between patients and answer specific questions. And I do enjoy having those conversations with people so that they know they're in the right place. Obviously, they can go on to thermographycenters.com, go on my website, and they can get as much information as they can. They can set up, an appointment if they would like. And I think there are times where we'll do in-house lectures and question and answer on thermography. So several ways that they can reach out, obviously.
This is fun, particularly going into areas where people either said, thermography, what's this all about? Or they want more data, where they want more information so they can really understand it. But if you go to Thermography Center's website, and there's a lot of data there's a lot of information. If you need specific, you got a question, call the office. Very simply, you can reach out at 703-698-7117 and leave a message for Derreth. She'll come back to you very, very quickly.
Or if you want to email me, you can obviously do the same at thermographycenters@gmail.com. I'll be more than happy to address any questions you might have.
Derreth, thanks. This was fun, and hopefully it shed a lot of information in a very different way for many people who were not really understanding what this thing called thermography or thermographic imaging is really all about. But it's an important piece of diagnostics, and I would encourage everybody to take advantage of this type of technology, because it can add so much to what's going on. If you think that you're developing a vascular problem within the carotid arteries of your neck, if you think that you're having some problems with vascular flow to the brain. Now, obviously, you can't look inside the brain, but can look at the distribution of the thermal patterns that come from the brain. This is an opportunity. This is something that you should at least look into and figure out what it's all about. But if you have any questions, please reach out, please ask, and we'll do everything that we can to get that data to you. Derreth, thanks a lot. Appreciate
You're very
it.
welcome.
See you later. I hope this was informative. I hope that it gave you another piece of the puzzle that you can take in control of. Remember, my theme is Ageless Health. Health is a do-it-yourself program. You're the commander. You have the opportunity to turn virtually anything around in your life, as long as you know the information and you know it so you can apply it. I love you all. See you next week with another program.